Hey, it's Nurse Kate. Today we're going to get a tour of the trauma bay.
Hi, I'm Judy. I've been in Genesis for 19 years. I started the community ambulance, spent 10 years in the lab, and I've been up here in the ED since then. So today we're going to get a tour of the trauma bays. This is our bedside table right here. This has all our IV supplies. We try to keep everything in here that we would use like the first 10 minutes with the patient. If like starting IV, more IV supplies. C-collar. They don't come in and C-spine. A lot of times we put them on C-collar. All right, and obviously some chucks. This is our boom, and the thing that's nice about this is it does move. It's almost like a hydraulic up there. There's like joints up there. But oxygen, we also have extensions on here because the head is always down here. They always come into the room feet first. So, but anyway, we get them on the monitor, like I said, right away. You want to get blood pressure, you want to get a good set of vitals, pulse, and you get them on the monitor. Also, you'll want to get a temperature. That's why we keep a thermometer in here all the time. And you'll notice, like I said, it's warm. We keep it all the time at about 74 degrees in here. Suction, you want a good suction. We keep 2 suctions, 2 things of oxygen. Like I said, the fast machine, that's one of my biggest things. Just as a tech, I like to have this turned on the minute I walk in, because I always joke they should call it a slow machine because it's not fast. But it's a good way for them to get a quick look, especially specifically to look for like internal bleeding. This is a Broslow bag. It's excellent for like pediatrics. If we got a kid that's coming in, we're not sure what's going on, I like to have this tape laying on the bed. It's a great way of length, and we can get an idea of what size they're going to need of certain things. So we have this laying out on the bed ready for them when they come in. So you measure the kid, and it just kind of gives you an idea. Charting nurse right here. Also too, back here, stickers and things that go for our labs. We get them back here, we scan them, send those down, obviously labs. So, but I just want to show you a lot of resources back here too. So we kind of keep it in order of where things are. Obviously we have our crash cart. We got a lot of airway supplies. This is a lot of just adjuncts as far as making sure that you can get access for like chest tubes, things like that. Central lines, blanket, all kinds of stuff. Central line, chest tubes. This is all more wound stuff, a ton of wound stuff through here. Temp sensing Foley, we put extra C-collar supplies up here that we use. And this is all our PPE area over here. So gloves, gowns, foot coverings, the whole shebang over here. Physicians a lot of times are back here, come back in and stuff with us. So, and we, like I said, if it's a level 1 or 2, at level 1 we get a lot of people. So.